Okay, so Dr. Winter, I think the first thing is just if somebody was to test positive and give you a call, what would be the first advice that you'd give to them?
The first thing I would say is stay away from people. When you get the virus, the coronavirus, you have the chance to kill it and keep it from spreading to somebody else. So first thing, stay away from other people at that point. Now, as far as what to do yourself, well, hydration's important. Drink lots of water. You're going to need rest. Get the rest. Don't fight that. And then use over-the-counter cough medicine, anti-inflammatory medication, Advil, Aleve, acetaminophen if you like. Those will help with symptoms. So treat the symptoms. But that takes care of most people. With the current strains going around, they're, for most people, pretty mild illnesses and don't need a whole lot of other stuff to be done.
People may have been hearing about like, oh, we now have all these pharmaceutical treatments like, we're talking about Paxlovid. Is that something for everybody? Is that something for some people? I mean, how do people find out about that if they've been hearing about it?
Yeah, if you are age 12 or older and have some immunocompromised condition, say some chronic illness, diabetes, hypertension, heart disease, any of those things, it wouldn't hurt to take Paxlovid. That does work very well. If you're over age 50, you should probably consider Paxlovid. If you're young and healthy, you may not need it. Now it's 6 pills for 5 days, 6 pills a day for 5 days. It's easy to take. It gives you a terrible taste in your mouth, by the way. That's the worst side effect that I've seen, but it works well, and you can get that if you want it. But not everybody needs that right now.
Is there, a lot of people might say, okay, I'm going to tough it out at home, right? Like you mentioned the over-the-counter medication that people can pick up. Is there any point where you'd say, hey, you should actually go see a doctor or maybe even go to an ER? What should people be maybe monitoring for or watching for at home as they're kind of watching their symptoms?
That's an important question. We see a few people who do need to go to the hospital or at least to be checked out in the emergency room. Those folks get very weak, very tired, confused perhaps. They get short of breath. We saw a lot more of that with the previous strains of COVID. If you start to get short of breath, I like people to check the oxygen. You can get those little finger cots called oximeters. And if your oxygen level drops below 92, you need to talk to a doctor or go to the emergency room. Those are things to look out for. Otherwise, if you're just hanging in there with fatigue, dry cough, sore throat, just get some rest at home. You should do well.
Now, we just talked about being positive. What if, let's say, a family member is positive, but I still feel fine, or maybe, I was exposed to somebody at work or at an event. Do I need to stay home? What's kind of the guidance at this point on what's the best thing to do?
If you're exposed significantly, and that means you're around somebody for 10 or 15 minutes in close proximity and they turn out positive, it's good to take yourself, be careful for a couple days. Stay away from other folks till you know that a test probably is not going to be positive at first. It takes 2 to 5 days to become positive, so you won't even know at first. So if you're concerned, get a home test. They work well. If it's negative, though, wait 2 days and get another test before you finally say, I'm safe, I can get around people again.
The guidance I think that we got at the beginning, or what everybody was talking about, is, hey, if this is going to be like the flu, vaccines may be something that we end up getting each year, like a regular flu shot. Well, a lot of people are coming up on a full year since their third shot if they've gotten a booster, or for some people, they need to get a booster. Are we expecting another booster to come out? What are people who aren't, above 50 but are waiting on another shot supposed to be doing right now? Should they be concerned at all?
I think you're correct. It's probably going to be like influenza. You need to get a shot periodically, probably once a year. The exact cadence we don't know yet. We haven't figured that out because it takes time to learn how long do the shots last. Do we need a different shot every year like influenza? Probably. We're looking at that right now. The current vaccines work for all the strains right now. A new strain, a new vaccine addressed specifically at these variants is a good idea. It might work a little bit better. It's not out there right now, but yes, I think we'll probably need to get another shot probably about once a year or so, and time will tell what the cadence and how frequently we'll have to get one.
We've talked a little bit just now about like people who are vaccinated, but I should point out, as you well know, there are a lot of people who aren't vaccinated, and especially now they might be saying, well, I know so-and-so, they're fully vaccinated and they just got COVID. What has been your kind of continuing message to people that either you're seeing or just your message to the public, people who haven't gotten vaccinated yet, who haven't made that decision? What would be kind of your message to them?
Well, I would say that the majority of people do perfectly fine. The ones who get sick, the ones who end up in the hospital, the ones who die, are almost all unvaccinated. There's rare exceptions to that right now. We've got a few people in the hospital now, way down from what they were before last year, and they're all unvaccinated. So if you really want to protect yourself, get a vaccine. It's the same thing with influenza. Influenza kills people every year also, and it doesn't kill people that have been immunized against the influenza virus. So if you really want to protect yourself, the vaccine is the way to go.
You're obviously seeing patients. What questions are you getting from people, or maybe are you hearing that you want to make sure that you address, maybe something that's coming up often you want more people to know?
Boy, that's a good one. Certainly I think the message is if you're going to be out in crowds, then you need to be careful. Think about that. Masks aren't required much anymore, but they still work. So if I go out to an area where there's a lot of people congregating around, particularly if it's kind of a rowdy crowd, people are talking or singing at a concert, I tend to wear a mask. If I'm getting on an airplane, I'm still going to wear a mask. Overseas, there's a lot of COVID over there. There's a lot of COVID all around the world. So if you're going to go overseas, then you might want to consider that. Thank goodness they just released the testing to come back to America, so you don't have to worry about that. But I've got, until this last week, 5 couples, patients of mine, stuck overseas in a variety of countries who can't get back because they're testing positive. They're not that sick, but they can't travel. So a lot of things to think about in crowds when you're around people that you're not sure if they're safe. If you're in areas where people don't tend to get vaccines, that's where I'm going to be careful, and I'd probably wear a mask or just stay away entirely.
No, that's really important, especially as we were just talking about, as we're seeing maybe not so much hospitalizations ticking up a little bit, but more so just cases, especially now in the summer, ticking up a lot. Dr. Winter, anything else I didn't cover that you want to make sure you hit on? I really do appreciate you kind of walking through everything with me.
Well, very clearly now, the variants that are going around in this country, they tend to have a mild outcome, but that doesn't mean the next variant is not. So remember that you have the chance to kill the virus if you get it. So we want to stop the spread. That's why we want to make sure if you have it, try to stay away from other people, because the next mutation, and they are going to continue to mutate, the next one could be a bad one. So that's what I worry about, is people get too lackadaisical about this coronavirus. It is pretty mild right now for most people. If you're old and frail, if you're immunocompromised, you are vulnerable for this thing. But for the rest of us, we're probably going to do fine with it. But we want to stop the spread of this virus so we can finally go back to life as usual.
Well, to that point, I guess the one thing I didn't touch on, just to reiterate it really quickly, is you don't know if you have COVID if you're not getting tested. I mean, part of what this story will share is, you can get the either USPS to mail you kits, you can go to CVS, to a Walgreens, you can get it for free, you can get reimbursed. I mean, you can get testing basically as much as you want, whether you thought you were just at risk or maybe you're just feeling crummy, right? It's very easy to get tested these days.
The testing is important, and the home tests are very good. They're not always accurate on the first time you check, but if you wait another couple of days and check it, you're going to get a reliable information right there. I've seen folks that I thought probably had allergies that had COVID. I saw a gal last week. She had what sounded like gastroenteritis, stomach complaints. She had no upper respiratory symptoms, no head congestion. She had COVID. So if in doubt, just get a test. They're pretty darn good, particularly if you do them serially.
I really do appreciate it. Thanks so much, Dr. Winter, for your time. You take care.
All right. Thank you.